Dave. No. He's going to come right where the flag is.
All right, good afternoon and welcome to Gowen Field. I'm Major General Michael Garshak, the Adjutant General of Idaho and the Commanding General of the Idaho National Guard. Today we are honored to host our Commander-in-Chief, Governor Brad Little. Also joining us here today are Brad Ritchie, Director of the Idaho Office of Emergency Management, and Dave Jepson, the Director of the Idaho Department of Health and Welfare. And the Idaho National Guard routinely plans, coordinates, and trains with the Idaho Office of Emergency Management in preparation for all possible emergencies. And although this current COVID-19 pandemic is unlike any of the emergencies we've experienced, our priorities are consistent throughout all emergency response efforts. First and foremost is the health and safety of the citizens of the state of Idaho. We first begun actively assessing our response capabilities to the coronavirus in late January, preparing for a potential outbreak here in the state of Idaho. Since then, the Idaho Military Division has been in constant communication with the Governor's Office and other state agencies, preparing for any support we may be asked to provide. The men and women of the Idaho National Guard are trained and ready to support our state, our counties, tribes, and local jurisdictions. Whenever the Guard is called upon, it is your friends and your neighbors who answer the call and put our training, our equipment, and our skills to work to protect the safety and well-being of our fellow citizens. And it is now my honor to introduce our Commander-in-Chief, Governor Brad Little.
Thank you, General, and thanks to all the men and women in the Guard that are here that are helping us today and are going to help us in the future. Idaho's situation with the coronavirus is changing rapidly, as you all know. We've been preparing for the coronavirus in Idaho since January, as the Governor alluded to. The first case was then confirmed in the United States. Idaho is one of the last 5 states to have a confirmed case of the coronavirus. And even before we had a confirmed case, I issued an emergency declaration to help us prepare. I have been in daily contact with our state's public health experts who have been guiding me in my decisions about the state's response. The experts tell us that the timing of decisions are extremely important. Every state is in a different stage. I am confident that the decisions that we have made in Idaho over the past few weeks and months have been solidly grounded in the advice of our epidemiologists and our infectious disease experts. That said, Idaho is now in a new stage. With confirmed community transmission now occurring in Idaho's most densely populated areas, I want to provide an update for our citizens on our latest steps to respond to this emergency. Following the guidance of our public health experts, today I will be issuing a statewide stay-home order for all of Idaho. From the get-go, our focus has been to slow the spread of coronavirus to protect our most vulnerable citizens and preserve capacity in our healthcare system. The stay-home order orders citizens to self-isolate at home if you can, not just if you're sick. If you are high risk, avoid leaving home. You can leave home to obtain essential services as defined in the order. Employers that do not provide essential services as defined in the order must take all steps necessary for employees to work remotely from home. Grocery stores, medical facilities, and essential businesses will remain open. Restaurants across the state are being ordered to close dine-in, but drive-through, pickup, and delivery will still be available, and I encourage all of us to support our neighborhood establishments. Non-essential businesses and services will close their physical locations. This includes bars, nightclubs, gyms, recreational facilities, and others not included in the essential category as defined in the order. People must limit public transit unless to provide or obtain essential services. People must limit all discretionary travel. People must limit all non-essential gatherings of any number of individuals outside the household. When you go for a walk, run, or bike ride, or other outdoor recreation near your home, stay 6 feet apart from individuals who are not part of your household. Our healthcare, public safety workers are putting themselves in harm's way to respond to the coronavirus emergency, and we owe it to them to do our part by following the statewide stay-home order. The statewide stay-home order is in effect immediately and will remain in effect for 21 days. Our public health officials and I will consider whether to renew the order in a couple of weeks. We're going to work with local officials and businesses throughout the day today to finalize the wording in the stay-home order, and it will be available later today for all to read on coronavirus.idaho.gov website. In addition, given the spread of coronavirus in Idaho, today I am signing a new extreme emergency declaration. Our state and our country are going through difficult times. The state, and me as your governor, need to be able to react quickly and effectively to combat the growing emergency to protect you and our neighbors. This extreme emergency declaration allows the state to more effectively increase healthcare capacity, take steps to reduce the slow of the spread so that as few Idahoans as possible are affected and the healthcare system is not overwhelmed, and take rapid and decisive steps to improve the condition of Idahoans whose job and incomes are being harmed by the pandemic. I will exercise these powers carefully and honestly, and always with the goal of protecting the citizens of Idaho for both the near term and the long term. The Idaho National Guard is preparing to support civil authorities and local jurisdictions during any state or local emergency, including the coronavirus emergency we find ourselves in right now. Public safety is always our top priority. The past couple of weeks, we have been focused on mission planning and identifying the necessary logistics required to accomplish those missions. Potential mission packages could include mobile testing support, transporting commodities, providing facilities, tents, and other equipment. The personnel I activated at the Guard are preparing to stand up a joint task force if requested. A joint task force can range from a size of 20 to 200 to even 1,000, depending upon the need. The Idaho Office of Emergency Management, a part of the Idaho Military Division, is the key emergency response planner and coordinator for interagency preparedness in Idaho. Brad Ritchie, director of the Idaho Office of Emergency Management, is part of my coronavirus working group and has been in direct coordination with me for weeks. Today, we just finished a meeting with the Idaho Office of Emergency Management, and they are engaging with our health professionals, and I am pleased with their decisions and vigor in responding to the coronavirus in the state of Idaho. Upon order from me, the Idaho Office of Emergency Management will coordinate with the Idaho National Guard to provide the support to civil authorities. This is yet another step we are taking to be able to provide a swift response as coronavirus cases continue to increase across the state. They stand ready to serve. Again, I want Idahoans to know that every step of the way we have been making sound decisions about Idaho's response to coronavirus based on the best advice of our public health experts. I would like to reiterate, we are doing everything at the appropriate time to prepare Idaho for further spread of coronavirus. We are all in this together, and we all must do our part. I am proud of Idaho and the way we support and love our neighbors. My fellow Idahoans, we will get through this together as long as we all play an active part in fighting the spread of coronavirus. With that, I will sign the emergency declaration and take questions.
Kevin,
Yes.
who will enforce these new guidelines, and what is the penalty if somebody doesn't?
Well, it's all relative. Obviously, what's taken place in other areas is, as is often the case in Idaho, peer pressure from the communities is always our first preference. We will look at each instance case by case. We need your help from the media to get this message out. It's a little unfair, not that everybody doesn't watch every one of your media outlets every day, but it's a little unfair for us to do this without having some time. But that's also part of the timing. Given where we are in the biology of this disease, it's important for us to do it now to make sure that message gets out to all of Idaho. Well, that was good. Thank you. Oh, Joey.
I want to do a quick follow-up to the enforcement. If someone isn't following this, could they be arrested? Could they be put in jail? I guess what could happen?
We'll look at it. We absolutely have to have this to take place. But if you look at what's happened in Blaine County and what's happened in Ada County or in the city of Boise, I can tell you that the compliance is really high, And so that's what we want to see. Our goal isn't to arrest people. Our goal is to keep Idahoans safe by maintaining this stay-home order.
I'm wondering what your message to Blaine County is, because they've, had the most cases and they've had community spread there, and I'm wondering what you say to that community that, has kind of been there for a while.
Well, of course, Blaine County, I think the Blaine School District, because they had one of the first cases, was the first school district to close down. I would submit that's why the system worked, was because they made that determination in their community, because they were one of the first, when other areas were a long, long ways from any community spread. So we're supporting Blaine County, but Blaine County is actually part of the genesis of this decision, because the stress on their healthcare system up there, particularly given the place where some of that spread was taking place, meant it was really important for us to preserve capacity in the Twin Falls area, over here in the Treasure Valley. So there's a nexus between all of those issues. Yes?
Governor, is the order going to be available in Spanish as well?
The
order you're signing?
It'll be on the website later today.
And will it be available in Spanish as well?
Yes.
Okay.
Yes.
So, going back, sorry, just to really nail it down, can you be arrested or cited for disobeying the order? What exactly are the penalties?
Well, I don't think if you're out for a walk and you're 5.5 feet from somebody, you're going to be arrested. It's all relative to what we're trying to do for public safety.
Governor, I'm wondering if some of the national rhetoric has an influence on your decision here today.
No.
Wanted to also ask, so can Idahoans still go out and exercise outside, take their dog on a run?
That was in my talk. As I said, we're in it for the short term and the long term. Maintaining the health of everyone, there's reasons that people do that. We're blessed in Idaho that we have a lot more, we have social distancing just because of what we are, and it's important to comply with that. But we want people to get their exercise because of the respiratory nature of this. Having a good respiratory system is good, but you got to maintain that social distancing. Keith?
You said you've been looking at what other states and countries have been doing. That kind of gives you a little bit of a crystal ball into the future. What do you see in Idaho's future now with this coronavirus?
Well, I mean, as we have gone on, Director Jepson and I and Elke and Chris, we talk about, the epidemiological models for issues like this. But every day, we are modifying our model relative to Idaho. If you're in New York, where a high percent of your population is on mass transit, and you had wild community spread, we don't have that. So we're trying to modify national and international epidemiological models to what works in Idaho. And Dr. Hahn, they're working with that today. So we're making our predictions on the future predicated on what the standard is in the industry and also how Idaho is different from those other states. So we're doing our own modeling. And every country in the world, every community is doing the same thing.
Can you say specifically what caused your action today?
The fact we're sticking with where we've been all along, which was the CDC guidance was when you have community spread, and initially we just had it in Blaine County, when you have community spread, then you have to go to the next level, and that's what we're doing. We're following what we said from, I think, my very first press conferences. We're following the guidance from the Center for Disease Control.
Governor, is the state concerned at all about any resources running out, whether that's ventilators or ICU beds or anything like that as the weeks keep coming along?
Yeah, of course we are. I mean, that's the two tours, the Idaho Office of Emergency Management, the inventory system that Director Jepson has, the Department of Health and Welfare. We spent a lot of time looking at spreadsheets. We spent a lot of time compiling a list from everyone from our hospitals to our assisted living centers to our emergency police, sheriff, fire. We are compiling. I just looked at the spreadsheet downstairs a minute ago, and then we're working with our federal partners, with FEMA, with the national distribution, talking to the vice president, talking to the president. Yeah, we're spending a lot of time. If I go back to my graph, which both Dave and I can't go very far without our graph, the line, which is our healthcare capacity, that personal protective equipment, PPE is the nomenclature, is determined by how much equipment, personnel and equipment and capacity we have. So the team, Director Jepson's coronavirus working group, is always looking at what's our weak link, what's the next thing we're going to need, and that personal protective equipment is part of that. We have one order that's just got here, I think, and others on the way, but we're trying to manage that as best we can for the whole state of Idaho.
Governor, what role could the National Guard play, and at what level would you then call them into?
It's all relative to what happens going forward. By this extreme declaration I did today, it just ramps us up to the next level. As I think I said, it could be 20, it could be 200, or it could be 1,000. So we will, as the need arises, we'll address that on an as-needed basis.
And then what kind of a needs would then the National Guard assist in?
Well, it could be commodity transportation. It could be assisting a local community if their community gets overwhelmed. It will, but I want to reiterate, we've been working on this for a long time. This is not like today we flipped the switch. We are flipping the switch on something that we've been preparing on, not only just since January when the coronavirus first was diagnosed as showing up in the United States, but we do emergency planning. Our Office of Emergency Management, Brad Ritchie and his shop, coordination with the National Guard. This is something we do all the time. The last time we really had an event was we did the planning for the eclipse, because we thought we were going to get 8 billion people from the West Coast that were going to come here. So we planned for the worst, hoped for the best, and did a great job of getting through it. We do it all the time. That was one we knew was coming. We do it all the time on floods, on fires. This is a little different, but the fact that we've got the network in place, that we've got people in the local communities, that the county commissioners, that the cities, that the sheriffs, that the members of the men and women of the Air and the Army Guard are aware of it, just makes the implementation of this a lot easier.
Governor, in the order you say that, grocery stores, medical facilities, and then other essential businesses will stay open. What are those other essential businesses?
Well, if obviously anybody that serves in the food chain, because we have to have food not only for us, but the food we produce in Idaho for everybody else in the United States. So that's part of it. Anything in the safety, public safety area. People, if your car breaks down and you can't get to the grocery store, fixing that car is an essential service. So it's pretty self-explanatory. We will have when the order gets out, we will have a way to address those concerns. I think, and Director Jepson might be able to add to this, I think that Blaine County will tell you that since we've implemented the order, there have been some questions, but it's gone relatively smoothly in Blaine County. I think that's fair. So.
I also wanted to just quick follow up. Are liquor stores going to be included in the essential businesses?
I think from a grocery store standpoint, they are, but they will. I frankly haven't been worried about the liquor stores very much, but they will do, I think, social distancing, but I'm not sure.
Governor, I know it's a tough time, but what would be your message to small business owners or people living paycheck to paycheck
Well, that's an incredible concern, because as I said in my talk, the near term and the long term, and there's the health from the coronavirus standpoint, but there's also the social emotional health, and if you look at what's taken place in some of these areas where they've been shut down for a long time, my message is we are going to do all we can to help. We talked about the regulations we're clearing out of the way. We talked about what we're doing to try and facilitate the time it takes you to get unemployment. There's this big federal program that we're still getting details on. An hour ago, I was on a phone call with a bunch of governors talking about what that's going to be, how we deliver those resources out to the people of the state of Idaho. We're going to do all we can to make it as easy as possible, but I worry about that. First I worry about their health, but I worry about the social well-being, the fabric of our society, if those businesses, A, the employees, and B, the businesses go under. And I'm afraid some of that's going to happen. We're just trying to minimize it all we can.
With the statewide order, do you plan on putting any sort of moratorium on evictions, anything like that, since people?
We've had multiple conversations about what we do from the judicial side, and then the conversations we have with landlords, commercial landlords and residential landlords both. Now there's going to be, in that area, we know that there's going to be a lot of SBA money available for landlords, particularly landlords that modify and do some forgiveness. Those details will be coming forward later.
In numerous conferences, you expressed concern about the lack of medical supplies that Idaho has in some areas. How is the state doing now on ventilators and protective masks, that sort of thing?
Well, that call I was with, this is not only a state problem, a local problem, and a state problem, a national problem, but it's a world problem. If somebody would have seen the magnitude of this pandemic coming, they would have been in any of those critical parts of the industry of the PPEs, and I'm learning more and more about PPEs than I ever wanted to know. But I will tell you, in Idaho, and we've had this input from the federal government, the way Dave Jepson, Department of Health and Welfare, takes care of and watches the inventory that our critical people have, we are way ahead of some of the other states as far as being aware of what we have, having the ability to move things around. Every state's in a critical condition on this. We know there's a lot of production coming. We know there's a lot of ramp up. We actually have some entrepreneurs in Idaho and some volunteers from great businesses that are trying to help us out in the different areas. This will continue to be a big emphasis. It has been of Director Jepson's working group, and it will continue to be. But the people downstairs that are in Brad Ritchie's shop, that's one of the things they're doing. They have great, I'm kind of an old spreadsheet guy. They have great spreadsheets on the wall about where are weak links, where do we need to address our weak links. So this is going to continue to be an issue. But believe me, I'm being on a call with these governors, it's an issue everywhere.
Are you saying that the state is actively seeking to get more medical supplies?
Actively would be a mild understatement. Yes.
Governor, just to clarify, is this order, similar, kind of mimicking the order that was placed over at Blaine County?
Absolutely. I don't know how much it's been tweaked. Do you know how much it's been tweaked? Go ahead, Dave.
Okay. Thank you, Governor, and I'm happy to answer that question. Yes, we spent quite a bit of time, probably longer than some of the citizens of Blaine County may have liked, actually, to get that first order out, because we wanted to do it correctly. We wanted to do it right, and we wanted it to be a template that we could use across the state, either locally or statewide if we need to. And so that has been the basis of where this order will come from. There is some tweaking that's going on, but by and large, if you look at that Blaine County order, that's what we'll be at the end of day today.
And I want to reiterate, when we did that order, Dave and our office, we were on the phone with the county, with the city, with the mayors, and that's what we are trying to do now. Is to, one of the things that I've learned in this process is try and ask the right questions. What are we not asking that we should have? And from a preparedness, from these three leaders up here, and from the people that are working from them, we are trying to address preparedness in every way we can.
What do you say when people try to access unemployment? Will there be any extension towards that service?
There's going to be a lot of programs. I know that you all saw that we had a big spike in applications this week, and we know we're going to have another one this week. What do we do about the waiting period? What do we do about the work requirement? Some of those I can waive. Some of those we'll have to work with the federal government, but that is of paramount importance to us.
Question for Mr. Ritchie?
Sure. Brad?
Sir.
Sir, could you explain the things that you have available to you down in your command center and what you're looking at and what you're doing?
Well, before I answer the question, and it's a great question, I need to make sure that I put the appropriate thanks where they belong, and that's with the governor, the working group, Director Jepson, and all the members of the working group, because their cooperation, their ability to come in and collaborate and work with us has been amazing. It's been great. I think we work well together, and I really appreciate all the help and support, not only from our two agencies, but across the state. So when you say resources, I would say we have plenty of resources downstairs, but we also have resources across the state. We do a daily phone call across the state. We talk to all the district healths. We talk to local jurisdictions, we talk to the tribal nations, we talk to the emergency managements that are on the front line. We try to build our awareness across the state to see what we can do and how we can expedite any type of resources they may be requesting or they could need, or the help that they need. All the state agencies have been extremely engaged with us to try to help and support. Department of Lands, Department of Transportation, the Idaho State Police. It's been an amazing collaboration where we're all in, we're all trying to help, we're all doing everything we possibly can to make things happen. But it starts with good leadership. And the good leadership that we've had from Governor Little and all the folks on the working group, I think has been amazing and has helped us lean forward and try to do everything we possibly can, be prepared for now and any time in the future.
Can you paint a mental visual picture of, like, if I were to walk down there? I know you have big monitors on the wall, all the walls and things. What are you trying to accomplish visually down there that will help everybody?
Well, another very good question on what we do. I had the opportunity to show the governor what Web EOC looks like. Web EOC was a vision from previous emergency managers where we're in contact and we have the capability to reach out to every county. And based on that, it doesn't matter whether it's Teton County, Boundary County, Franklin County, we have the ability, and with the emergency management staff they have in place in those counties, they are in contact with us to let us know. But not only that system, we also have the private sector in there as well. So we understand and we start looking at the supply chain to ensure the supply chain is up and functioning, and how and when we could potentially run out of things. Or when we should start to see the supply throughout the communities return to normal, or the new normal, on what that may be. Thank you.
I have a question for you also. Sorry, the governor spoke about the spreadsheets you have and how organized it is down there, and about being able to point out the weak links. What would you say some of those weak links are, or where are we weakest right now?
I think understanding how long our PPE is going to last and understanding which individual item, how long that's going to last, what our burn rate is, and how we're evaluating how often do we order based on the burn rate. You know, other things we're looking at as opportunities is how do we recycle PPE? There's opportunities out there if you have a procedure in place in which you can recycle your PPE. So that may be a very temporary solution to the lack of supplies that we may be receiving right away. But those would be some of the things that we're looking at, trying to evaluate, come up with the best situation to help us through the next week or so.
Is there anything specific that the public should be concerned about that may be next?
I would just say I think everything that the governor's doing is amazing for the citizens of Idaho. I think if they listen to what the governor has said, the directions he's put out, they should go about living their lives, even though it's a little different living of your life than what we did 2 weeks ago or 3 weeks ago or 6 months ago. But I would just tell people that hoarding is not a reason to run out and grab all the toilet paper off the shelves or Clorox. But live your life and take responsibility to do the best you can with hygiene. Listen to the leadership. The leadership is putting good guidance out there. They're working across the state to try to make sure that we're not only focusing on anything that happens in the valley here, but we're also looking up north. We're looking at everywhere across the state to try to do and help the best we possibly can.
Troy, let me give you one example of what we've been doing on that very issue. Our Department of Agriculture had a lot of masks for what they do in the agricultural area that now we made available into the healthcare area. But that was because of the planning and the conversations we've had. But on the issue of hoarding, particularly profiteering, my first emergency proclamation basically allowed the Attorney General to people that are going out and profiteering to be subject to criminal. And you heard the President talk about what's going to take place on the national level, because that's helpful, because a lot of times we can't reach across state lines. So having the federal and the state both in a situation to where people that are trying to figure out what's the one thing we need the most, they make the most profit on, if they go after it, they're at risk.
The Idaho profiteering law is actually extremely restricted with what commodities it covers, basically food, fuel, and a few others. It doesn't, for example, cover things like, say, bathroom tissue. Is there any plans to expand that to more commodities that people have been hoarding, like Clorox and toilet paper?
Well, we do have one of the biggest toilet paper plants in the world in Idaho, so it might be a matter of timing. But we'll look at it, and if there's something that we're missing in there, I think, and I'll have to check, but I think under this emergency order, particularly if it's a regulatory standpoint, we can modify it and put it in there.
About child care providers, is that an essential service to them?
Absolutely. Matter of fact, I think in our last press conference, that's not a small issue. That's a huge issue. The graph that Director Jepson and I usually travel with has the red line, which is our health care facilities. And you might think that's doctors or that's hospital beds. But nurses and doctors and healthcare providers and even the people that do the maintenance in a hospital, having child care for them to take part of the burden off of them is critical. And there's a lot of things going on in Idaho to address the health care, not only officially with our schools and with other areas, but in the philanthropic area. One of the persons that are downstairs is managing not only my departments, but also the philanthropic community and how they can be part of this. That's part of Brad's team that's downstairs.
Sorry. What should our homeless population be doing in this shelter?
Well, we don't want to increase it. That's probably one of the most important things, and that's why we're working on rental, on evictions. B, we want to be supportive of the local communities. If you're in Idaho, if you're in Boise or Coeur d'Alene, relative to a lot of other cities in the Pacific Northwest, our communities have done a pretty good job. But you know, it's going to be a bigger issue going forward, and we'll address that. But you know, the best thing I can do is have a safety net for people that just got unemployed to where they can make their rent payments. We've already talked to the utilities, and some of the utilities are trying to make it to where people don't get their critical utilities cut off. That's all part of trying to keep the homeless issue at a minimum where it is today, but we'd like to decrease it. But there's going to be stresses there, no question.
And then, also, it kind of sounded like earlier stay-at-home orders and stuff were going to be coming from the like the local health districts. And
no, the stay-at-home orders coming from me.
Yeah, but okay. All right, I appreciate it. Thank you.
Yes.
Does the state have any estimate or projections on, you know, peak infection rates, recovery rates if someone is infected, or anything along those lines?
Well, either Dave or Dr. Hahn, but we know that the lag in testing, you know, the data we have is because we don't have enough testing, just like everywhere else, is not as good as we'd like to have it. We know there's a big wave of testing that's coming, but regardless, this is necessary. What I just did here, it's necessary. But I think Dr. Hahn just told me downstairs a minute ago that 9% of the tested were positive. Did I get that right, Chris?
Close. 7.7%. Our last number.
7.7%. So.
Is there a difference between this stay-home order and shelter-in-place orders that have gone into place in other states?
It's generally the same. It's, you know, my goal is to get full compliance. That's, you know, you can call it whatever you want to call it. I want people to realize what it is. My goal is that we break this cycle, that we flatten the curve that we talk about all the time, and that's part of the goal in the language, is we want people to comply with it.
Does the state have a standards of care and crisis plan?
Dr. Hahn?
You're going to address it from here, or just
Okay.
You could go to the podium, please.
I usually don't get this far away from her.
I project well, but I know that.
Yeah, so the question was about a crisis standards of care plan. We are working on one. Dr. Marcia Whitty, who works with us and has been tasked with leading that group, and they've been meeting. We're hoping to have a plan finalized by mid to late April. So we don't have a plan in place yet, but we're moving very quickly on that to get that finalized.
Thanks, Chris. Are there a question for the National Guard?
Sure.
Please, General. General, you talked just a little bit, in your opening remarks about the readiness of the National Guard. What kind of things? Can you talk in more detail about what things you're preparing for if the governor does call?
Okay, thank you. The question was, what missions might we be preparing for in the National Guard if the governor calls? All the services that are being provided to the citizens of Idaho at the state, county, local level, even federal level, if they run out of capacity and capability, they submit a request for assistance to the Office of Emergency Management. They analyze that request, and if they deem that the Idaho National Guard is best prepared and capable of responding to it, then we get that mission assignment. So it's anywhere from transportation, shelter, logistical support. You know, we have capabilities and equipment that may be unique that can only do the job. Helicopters with hoists. So, you know, we're analyzing in conjunction with the Office of Emergency Management. In fact, the 4 individuals we've activated to date are working in the Office of Emergency Management, which is right across the hall from our Joint Operations Center, both headquarters in this building. So we're prepared to do all the things that are necessary to respond to this emergency across all levels of government.
Can you say how many you have a potential of activating and bringing in and helping?
Well, currently, based on their ongoing mission assignments, we have about 4,500 members of the Idaho National Guard, and at least 2,500 of them would be available. And I don't anticipate a response to that level in this emergency at this time.
Well, I kind of want to add on. Occasionally my wife might mention that I don't have very good patience. All 3 of these people up here do an enormous amount of planning. Sometimes I call it mind-numbing planning. But these are the times for the citizens of Idaho when that planning comes to fruition. The coordination between General Garshak and Brad Ritchie's shop is just incredibly important. The fact that they're right down there, right across the hall. The coordination we've had since January when we started with the Department of Health and Welfare, with our health people, with Dr. Hahn. This has been going on for a long time, and today we're going to see the dividends of what I call that mind-numbing planning. Okay, thank you very much. And I just want to end. It is incredibly important for us to get this word out to the people of Idaho. Your presence here, your networks, everybody in your networks, it's important that we get this out because we're trying to stop something from happening, and the best way to do that is for the people of Idaho to know about it. So thank you all very much.
We just finished listening to Governor Brad Little talk about the extreme emergency declaration. It is necessary, as he said at this point, to issue a stay-at-home order, and now this is statewide across the state of Idaho. And Maggie O'Mara also in studio with me right now, and this kind of puts us into the next phase as the governor described it.
It sure does. Everyone is being asked to stay at home. All non-essential services out there, businesses, the governor are being asked to please move your workers home if they can work from home. That is what he wants to see happen. Also, we should mention the extreme emergency declaration includes increased health care capacity so the governor can get what we need, taking steps to, of course, reduce the spread of the coronavirus. We're up to 98 cases right now, and help with lost jobs and income for so many Idahoans out there. Brian, maybe you could reiterate